All right, good day, everyone. This is Angel from BSB2-4, and for today we will gonna discuss as well the hoarding disorder, which is under the umbrella or related with the OCD. So for the overview, we will gonna discuss about the diagnostic criteria, its prevalence, the development and course, and lastly the treatment. So for today, when we say hoarding, typically we are actually thinking about collecting. So yes, we know for a fact that most people loves to collect, and to differentiate that with people with hoarding disorder, technically, um, when you say you are collecting, you are actually just choosing what you want to collect. So this is still normal. And when you have, or when a person have a hoarding disorder, they are actually um, feeling hard to actually, let go of those things that they keep or put a sentimental value on it, even though it's far from their actual value. So we will gonna discuss it furthermore as we discuss as well the diagnostic criteria. So for the first criterion, it's actually the persistent difficulty of discarding or parting with possessions regardless of their actual value. So the second criterion is actually the difficulty is due to a perceived need to save the items and to the stress associated with discarding them. So first, let's discuss the first part. They are thinking that there is a need to save the items. So which means they are thinking like, I need this, I want to keep this, and for this reason they are tend to not to let it go, they are tend to keep it, they are tend to not dispose it even if it should be disposed. All right, so the next criterion is the difficulty discarding possessions results in the accumulation of possessions that congest and clutter active living areas and substantially compromises their intended use. If living areas are uncluttered, it is only because of the interventions of third parties. So, to actually further discuss this, so it says here that especially someone with hoarding disorder are having a hard time or rather a difficulty of letting go of things that should be let go. Definitely, it results from having a specific space in their home to actually, cluttered, or what we mean like there are no space anymore for them to move. So this is not just affecting the individual with hoarding disorder, but rather also their family as well. So for this, like for example, someone is actually diagnosed with hoarding disorder. Definitely, they will actually this has been intervened when you see their place is uncluttered. So for the diagnostic criteria, the fourth diagnostic criteria that will be the hurting causes clinically significant distress or impairment in social, occupational, or other important areas of functioning. So for this, as we mentioned, that this is affecting their daily life. This is affecting their health as well. For example, since you do have these um, things that you keep, especially if it should not be, definitely it will gonna harm them as well. Like for example, in their daily life. So for the fifth diagnostic criteria, the hoarding is not attributable to another medical condition like brain injury, cerebrovascular disease, and Prader-Willi syndrome. So for the last diagnostic criteria, the hoarding is not better explained by the symptoms of another mental disorders like the OCD, the major depressive disorder, the schizophrenia or other psychotic disorder, and the major neurocognitive disorder, as well as the autism spectrum disorder. All right. So we should defer hoarding disorder to those that have been mentioned earlier. So now, for the hoarding, we do have a specifier as well. So we do have at least four. So the first specifier is excessive acquisition. It is when the person is having a difficulty discarding possessions accompanied by excessive acquisition of items that are not needed or for which there is no available space. So for this, just to mention that excessive acquisition is like you are keeping everything um, in which you are putting a sentimental value on it. And in this case, you are hard to let that go. So for this actually affects you as well, like the space in your home. So now, with the specifier good or fair insight, the individual recognizes that hoarding related beliefs and behaviors, items, or like the difficulty discarding items, clutter, or excessive acquisition are problematic. So for this, someone with hoarding disorder are seeing the problem of keeping things and having a hard time to let them go. So they're still um in touch with the normal since they're seeing the challenge. It's just that it is really hard for them to let things go. For the poor insight, the individual is mostly convinced that the hoarding related beliefs and behaviors are not problematic despite the contrary, evidence to the contrary. So they are mostly convinced. So when we say mostly convinced, it's like having a 90% of believing that something is true, that hoarding things is not a problem, that hoarding things is just fine, and the 10% is the hesitation. Okay? So that will be the case. So they are mostly convinced. Um, that differs with the absent insights and delusional beliefs we're in. The individual is completely, like 100% convinced that hoarding related beliefs and behaviors are not problematic despite evidence to the contrary. So for the prevalence, no gender difference identified. And this is actually in contrast with the clinical samples, which are predominantly in women. This is actually prevalent as well, mostly in adults. So, for the development and course, hoarding appears to begin early in life and spans well into late stages. Hoarding symptoms may first emerge around ages 15 to 19, start interfering with the individual every day, functioning by the mid-20s and cause clinically significant impairment by the mid-30s. Participants in clinical research studies that are usually in their 50s, thus the severity of hoarding increases in each decade of life, especially after the age of 30. So technically, the development and course for the hoarding disorder is technically slow. This is technically gradual. This is developing each decade, so in this case, this cannot be observed in, like for example, this occur in your adolescence. There is a high chance that you may not observe that you are prone to have a hoarding disorder in your 30s or more. So for this case, we do have the treatment for this specific disorder, the hoarding disorder. First is to reduce the anxiety about the throwing away items that are somewhat less valued. So they will gonna teach us what things should and should not be okay. So for this, it will gonna teach also people to assign different values to objects. So that those are the treatments for the hoarding disorder. So technically, in a summary, that hoarding disorder is about having someone having great sentimental value to everything that they are really hard for it to let that go. So for this, this needs to meet some criterias, and lastly, this should have an intervention. So that will be all for today, and thank you so much for listening.